Hypertension. Hypertension literally means increased tension, and it refers to an increased blood pressure. Pressure is the force applied by an object to a surface area. For example, if a person excessively drinks water, their blood volume increases, which will congest and apply increased force on the blood vessel. If not for the kidneys filtering the excess water out by us urinating, this increase in blood volume can dangerously increase blood pressure, which is why some patients with kidney disease develop hypertension. In another example, when blood vessels constrict, which can occur, for example, in cold weather to reduce conduction of heat from the body, the vasoconstriction applies force on the surface of the blood, increasing the tension in the blood vessel, and therefore increasing the blood pressure. This is also why hypertensive patients tend to be susceptible to a marginal increase in blood pressure during the winter season. To summarize, blood flow can apply force on the arteries and increase blood pressure, and vice versa. Arteries can constrict and apply force on the blood and increase blood pressure. So in blood vessels, the object and surface area are interchangeable, and both can apply pressure and increase blood pressure. Blood vessels are part of the greater circulatory system, which is a closed loop or circuit connected to a pump, the heart. This cardiac pump creates the pressure that encourages blood to flow across the circulatory system. This means we have a third object that can influence blood pressure, the heartbeat. Depending on how hard and how fast the heart pumps blood, the force created by the heart gets transmitted on both the blood and the arteries. Blood pressure is normally less than or equal to 120 mm mercury systolic and less than or equal to 80 mm mercury diastolic. Elevated blood pressures are between 121 to 129 mm mercury systolic, and a patient is considered hypertensive when 3 separate blood pressure readings are greater than 130 systolic and 80 diastolic. Although this represents the pressure within the arm, usually upper arm and brachial artery, this is slightly different than the pressure found in the aorta or other distributing arteries. Nevertheless, we use it as the standard value for systemic blood pressure. Blood pressure is measured using a blood pressure device called sphygmomanometer. It is an inflatable cuff combined to a pressure meter. The cuff is wrapped around the arm and inflated, adding pressure on the arm until the artery in the arm collapses and blood flow cuts off. The cuff is slowly deflated to relax, allowing blood to flow back again. This is monitored by the manometer to determine at what pressure the cuff allows blood flow to resume, systolic, and at what pressure blood flows completely unobstructed, diastolic.